I want to look at the land of Michael DeBakey in Houston Methodist, the acclaimed Houston Methodist, where they said, if you're not vaccinated, you're not working here. I don't have the exact number. I think it's 115 people, 150 people were shown the door. Morgan Stanley has said, if you're not vaccinated, you're not walking in the door. Is that where we're heading?
I have a feeling it is where we're heading. I think a lot of places will wait to get that final FDA approval for one or more of the vaccines. But I think the second we see that, we're going to see a lot more companies, a lot more private institutions going that way for sure.
Lauren, on the Delta variant, we have a case study playing out in real time right now. It's in the UK. From the data that you've seen, have we finally broken that link between cases, hospitalizations, and deaths?
I think yes, as long as we continue to push forward with the vaccination efforts. I think the challenge with the Delta variant is that it easily seems to be taking advantage of places where vaccination rates are low, and that is where we see that link continue to happen, right? So we see the people who are getting infected. It sort of worms its way into these populations that have lower vaccination rates or countries that have lower vaccination rates. And then your hospitals are suddenly overrun again, and people are getting really sick, and people are dying. And so the key to continue to keep that broken chain broken is to make sure that we keep pushing forward with the vaccination strategies, even when we're tired, even when we feel like we're not making a lot of progress, and identify those pockets of low vaccination, whether it's due to hesitancy, whether it's due to access. And push forward and try to support communities, try to support countries, try to support any areas that don't have high vaccination rates.
You've touched on the dilemma of the moment. The question I have for you, is this a healthcare system issue, a threat to the healthcare system, or just one of individual risk? In America, you have the luxury right now of walking out the door in 99.9% of this country and going to get a vaccine this morning. You don't have that luxury anywhere else. But in America, you have that luxury, Lauren. So my question is this about individuals, and it's up to them now, they can take the risk, or is it still about a threat to the healthcare system more widely?
I think it's actually both. I mean, and I know that's not a satisfying answer, but, the individuals who are not getting vaccinated are choosing to take that risk, or there's some barrier that we need to support them in fixing and resolving. But if that path continues without any intervention from public health, without any intervention from our healthcare experts, without any ongoing efforts to understand why they're taking that risk or understand why they're not able to or willing to access vaccine, then the risk grows, right? And the spread continues, and we don't stop that chain of transmission. And so even though it feels like an individual risk only issue right now in the United States, it is a risk to all of us if we let vaccination rates continue to stay low in certain areas.
Lauren, I want to finish the conversation where we started it, and that is Morgan Stanley telling its employees, cut it out, just get vaccinated, come back to the office, or else we'll have a really serious talk, akin to the likes of John and Tom and the way that they talk to each other offline. There is a question going forward about exactly what you were saying. FDA approval happens. All of a sudden, Morgan Stanley is basically the example for private businesses and perhaps even public schools around the country when they say, cut it out, get a vaccine, then you can come back. How far away from getting that FDA full approval are we?
I think we're close. Both Moderna and Pfizer have submitted their materials. And what's interesting is that I think this will also have downstream impacts for vaccines that are going to apply for emergency use authorization. So, for example, we just saw Novavax's very, very good output from their study. And so the question is, will future vaccines go for emergency use authorization, or will they push into the full approval pathway? And so I think we're going to see very quickly more and more vaccines going for full approval. And then that conversation about whether vaccines are mandatory is going to have to happen really quickly, right on the tails of that.